Good day and welcome back to Cornerstone Physical Therapy Associates. I'm Jeff Richards, physical therapist, and today we wanted to share with you a brief review of the importance of using good technique in recovering from shoulder injury, whether it be rotator cuff tendonitis, frozen shoulder, or even post-operative shoulder conditions once cleared by your therapist and physician to do these activities. They need to be done in a pain-controlled fashion, never allowing yourself to experience more than a 5/10 pain at any particular endpoint as you go through these movements. We're going to use a cane, which allows us to do them with active assistance of the uninvolved left arm in this situation. The right arm would be our involved limb at this point. Enjoy the presentation, and feel free to refer any questions to our website at cornerstonept.org. So these shoulder cane exercises are done while you're comfortably lying upon your back. If there's any history of low back pain, you may certainly want to put a couple pillows underneath your knees, which will improve the comfort for your lower back. The pillow under your head should just definitely support the head and neck itself, not under the shoulder blades at all, just to the tops of your shoulders to support your head and neck only. The first movement is simply a bench press movement that brings the cane up from your chest and back down. In this demonstration, I'm mimicking a right shoulder pain problem, and so you move slowly and comfortably as your shoulder allows you to, up from the chest level. If you do this too high up by your shoulder height, as you go up, that may pinch or bite on the rotator cuff. Please bring the cane a little bit lower and move it up and down from chest height, not shoulder height, with a speed that is under control and comfortable for you. 7 to 10 repetitions is adequate, and then we move on to shoulder flexion. To begin shoulder flexion, come on up to that bench press position and simply reposition your hands so that your cane is now resting in the web spaces of your thumbs. Your thumbs are going to point backwards, and you're going to go now into what we call shoulder flexion. I like to shorten it up and call it touchdowns. And you're simply going to go back to where the right shoulder allows you to feel tightness. That's going to be combined with some pinch pain, but respect the pain, no more than a 5/10. Pause for 3 to 5 seconds. Return back up to the neutral position, starting position. Again, slow control. Let the left uninvolved arm drive the cane backwards gently to allow your right shoulder to go as far as comfortable for you. That tight pain point is then held for 3 to 5 seconds. Return back up to the starting position. Repeat that 7 to 10 times. That is shoulder flexion. Next, out of that bench press position, simply lower your elbows down to the bed so you're at a 90-degree angle at your armpits and a 90-degree angle at your elbows. So from this 90-90 position, we call it, you're going to do 2 separate motions. The first one is called external rotation of the shoulder, where you allow the cane to rotate back directly over your forehead towards the overhead direction. Let your left shoulder rotate a little bit lower perhaps to encourage the right arm to come back further. Stop at the tight, painful point of no more than 5/10. Hold for 3 to 5 seconds. Return back up to the starting or neutral position. Again, rotate back, leading with the left arm. The right arm will tell you when it starts to feel uncomfortable. Respect that pain. Do not push through pain. Go to the point of 5/10 pain. Pause for 3 to 5 seconds. Return back up to the neutral position. And repeat 7 to 10 times for shoulder external rotation. From the same 90-90 position of your arms at 90 degrees at your elbow and 90 degrees at your armpits, simply now rotate the cane down and in towards your stomach. This is shoulder internal rotation. The cane will rest right along the base of the breastbone. Some folks like to call that the solar plexus. From that position and point, simply tilt the cane to the tight shoulder side until you feel a stretch across the front row of the shoulder. Hold that position for 3 to 5 seconds. Rotate back up. You can come back up to the neutral position if you'd like, or simply remain restful back at that solar plexus pivot point. Use that rib cage of yours as a seesaw to gently rotate the shoulder down and in, into internal rotation. Initially, your goal is to be able to touch your fingertips down to the bed. However, that's still about 15 or 20 degrees shy of full internal rotation. Eventually, you would like to be able to turn your wrist up and drive the underside of your wrist towards the bed or floor, and that certainly increases the degree of stretch felt through the front shoulder. You can see it's rather difficult to keep the elbow out at that 90-degree angle. Periodically, you need to readjust the arms out towards the 90-90 position. Come back down, rotate down and in, stop at the tight, usually combined with some degree of pain. Stretching of sore structures is going to be tender. Don't go greater than a 5/10 intensity. Hold for 3 to 5 seconds. Relax back up. Come back to the neutral resting position and repeat 7 to 10 times. Rotate to the rib cage. Tilt to the tight shoulder side. Gradually trying to drive the underside of your wrist lower and lower towards the bed. These classically take 2 to 3 weeks to get very comfortable with. Do not be in a hurry. Do your best for 7 to 10 repetitions each time you endeavor to do these, typically on a 5 to 6 times a week basis. From this position, we have one more position called horizontal abduction. We'll begin that in a moment. Horizontal abduction begins with a straight arm position up from that similar bench press position we used as a warm-up for these shoulder cane exercises. So with the arms up fully straight, simply drop both arms towards the involved right side in this situation until you get a nice, comfortable, tight stretch across the front of the shoulder. This is typically more tight than it is painful, but certainly respect that end range of tightness, and the pain should never be more than a 5/10. Come on back up to the starting position, and then repeat. Dropping the cane to the tight shoulder side, always having that helpful support of the uninvolved left arm to help you not go too low, but also to bring you back out of that endpoint position in case the right arm doesn't want to bring itself back up independently. So horizontal abduction, or simply reaching out to the side with both arms staying straight, gives us a decent stretch across the front wall of the shoulder. Return back up 7 to 10 repetitions. Relax back down to neutral, and you're done.
Thanks again for visiting Cornerstone Physical Therapy Associates. If there's any questions or further commentary or support information needed to help you do these exercise activities with ease, feel free to refer your questions to our website at cornerstonept.org, and we'll get back to you personally. Take care.